Major depressive disorder, often called depression, is one of the most common mental health conditions in the world. Yet, despite how common it is, it's also one of the most misunderstood. Many people think depression simply means feeling sad or having a bad week. In reality, it's a medical condition that affects emotions, thinking, physical health, relationships, and everyday function. In this video, we'll explore what major depressive disorder is, how it's diagnosed, and what symptoms to recognize, what causes it, and the evidence based treatments that help millions of people recover. Major depressive disorder, or MDD, is classified as a mood disorder in the Diagnostic and Statistical Manual of Mental Disorders, commonly called the DSM-5-TR. To receive the diagnosis, symptoms must last at least 2 weeks and cause significant distress or interfere with daily life. Everyone feels sad, discouraged, or overwhelmed from time to time. Those emotions are a normal part of life. Depression is different because it persists, affects multiple areas of function, and often doesn't improve simply because one's circumstances change. It influences how people think, feel, sleep, eat, work, and interact with others. Fortunately, depression is highly treatable and many people recover with appropriate care. Mental health professionals don't diagnose depression based on a single symptom. Instead, the DSM-5-TR requires that a person experience 5 or more symptoms during the same 2-week period. One of those symptoms must be either a depressed mood or a mark of lost interest or pleasure in activities that were previously enjoyable. Additional symptoms may include changes in appetite or weight, sleeping too much or too little, fatigue, feelings of worthlessness or excessive guilt, difficulty concentrating, slowed movement or unusual restlessness, and recurrent thoughts of death or suicide. These symptoms must represent a change from the person's normal level of functioning and cannot be better explained by another medical condition or substance use. That's why a comprehensive evaluation by a qualified healthcare or mental health professional is so important. When people hear the word depression, they often think only about sadness. While sadness is certainly common, many people describe depression as a feeling of emotionally numbness or emptiness. Others experience overwhelming hopelessness or believe that things will never improve. Some become much more irritable than usual, especially children and adolescents. Many also lose interest in hobbies, relationships, or activities that they once loved. Clinicians refer to this as adynia, and it's one of the hallmark symptoms of depression. These emotional challenges often make it difficult to connect with others or find enjoyment in everyday life. Depression isn't just emotional, it's also physical. Many people experience dramatic changes in sleep, either sleeping much more than usual or struggling with persistent insomnia. Appetite may increase or decrease, leading to noticeable weight changes. Fatigue is one of the most common symptoms. Even after a full night's sleep, many individuals still feel exhausted. Some people also experience headache, chronic pain, digestive problems, or generalized aches without an obvious medical cause. Others move noticeably slower than normal, while some become physically restless and unable to relax. These are genuine medical symptoms, not signs that someone simply isn't trying hard enough. Depression also changes the way people think. Concentration often becomes more difficult, making work or school challenging. Memory may seem less reliable, and even simple decisions can seem overwhelming. Negative thoughts often become much more frequent, leading people to focus on failures while overlooking successes. Many individuals also experience excessive guilt or harsh self-criticism, believing they're a burden on others or blaming themselves for situations outside of their control. These thinking patterns are symptoms of depression and often improve significantly with treatment. There isn't one single cause of depression. Researchers use what's called the biosocial model to understand how depression develops. Biological factors include genetics, brain chemistry, hormones, and certain medical conditions. Psychological factors include personality traits, coping styles, previous mental health conditions, and patterns of thinking. Social factors include relationships, financial stress, trauma, isolation, discrimination, and significant life events. For most people, depression develops through the interactions of several of these factors rather than one isolated event. Anyone can develop depression, but certain experiences increase the likelihood. Family history of depression suggests a genetic component. Trauma, abuse, or significant losses may increase vulnerability. Chronic medical illnesses, chronic pain, and substance use are also associated with higher rates of depression. Social isolation, financial stress, unemployment, and major life transitions such as divorce or death of a loved one can also contribute. Having these risk factors doesn't guarantee someone will develop depression, but understanding them helps identify when additional support may be beneficial. There isn't a laboratory test that diagnoses depression. Instead, diagnostics begin with a thorough clinical interview. Healthcare provider asks about symptoms, medical history, medications, family history, stressful life events, and how symptoms affect daily function. Sometimes medical conditions such as a thyroid disease, vitamin deficiency, neurological disorder, or medication side effects must be ruled out because they can produce symptoms that resemble depression. An accurate diagnosis helps ensure the most effective treatment plan possible. The encouraging news is that depression is one of the most treatable mental health conditions. Psychotherapy is often the first recommendation. Cognitive behavioral therapy helps identify and change unhelpful thinking patterns. Behavioral activation focuses on gradually increasing meaningful activities that improve mood. Interpersonal therapy addresses relationship problems that may contribute to depression. For many people, antidepressant medications are also effective, particularly when symptoms are moderate to severe. Dialectical behavioral therapy can also be helpful, especially when depression occurs alongside emotional dysregulation or self-destructive behaviors. Healthy sleep, regular exercise, good nutrition, reducing substance use, and maintaining supportive relationships can also enhance recovery. Recovery is possible. Some individuals improve with therapy alone, others benefit from medication. Many experience the greatest improvement through a combination of both. Recovery isn't always a straight line. There also may be setbacks, adjustments to treatment, or periods where symptoms return. That doesn't mean treatment has failed. It simply means recovery is a process, and many people go on to live healthy, meaningful, and fulfilling lives. Unfortunately, myths about depression continue to prevent many people from seeking help. One common myth is that depression is simply laziness or a lack of willpower. Research tells us otherwise. Depression affects brain function, motivation, energy, and emotional regulation. Another myth is that people should simply think positively or try harder. While healthy thinking and coping skills are important, depression often requires evidence-based treatments just like other medical conditions. Reducing stigma begins with replacing myths with accurate information. One of the most powerful reminders that depression is a medical condition is that it can affect anyone. Many well-known public figures have openly discussed living with depression, including Dwayne "The Rock" Johnson, Olympic swimmer Michael Phelps, Lady Gaga, Bruce Springsteen, Prince Harry, and author J.K. Rowling. These individuals come from a very different background and careers, yet they share a common experience. Their stories remind us that success, intelligence, wealth, and fame do not protect someone from mental illness. Perhaps even more importantly, many of them have spoken publicly about seeking treatment and encouraging others to do the same. Depression is not a sign of weakness. Asking for help is often one of the strongest decisions a person can make. If someone you care about is struggling with depression, one of the most valuable things you can do is simply be present. Listen without judgment, validate their feelings rather than trying to immediately solve the problem, encourage professional treatment while continuing to offer support and connection. If someone talks about wanting to die or expresses suicidal thoughts, always take those statements seriously, respond with compassion, and help connect them with immediate professional support. If symptoms last longer than 2 weeks, interfere with work, school, relationships, or daily responsibilities, it's time to seek professional help. If someone experiences thoughts of self-harm or suicide, seek immediate assistance through emergency services or crisis resources in your area. Early treatment often leads to faster recovery and better long-term outcomes. Major depressive disorder is one of the most common mental health conditions, but it's also one of the most treatable. If you'd like to learn more, visit my Shopify store found in my bio to download a free educational handout on major depressive disorder. It provides additional information that expands on what we've covered in this video. If you found the video helpful, consider subscribing and following The Quiet Mind. I regularly create evidence-based videos covering mental health diagnoses, coping skills, psychotherapy concepts, and practical strategies you can use in everyday life. Thank you for watching, and remember, mental health is just as important as physical health, and seeking help is often a sign of strength. See you in the next one.